Part A. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How are you feeling today?
Good morning, Dr. Wright. Well, for the past few days, I've noticed a strange yellowing in my skin and the whites of my eyes. It's mostly noticeable around my palms and forehead. Do you have any idea what it could be?
Yes, Mihira, this is often called jaundice, usually happens when a substance called bilirubin builds up in your bloodstream. To get a clearer picture, we can do a simple blood test to measure its levels. But before we jump to conclusions, let's gather some more information. Can you tell me if you've recently had any travel, changes in your appetite or bowel habits, or any unusual fatigue?
Actually, I did travel to East Asia a few weeks ago. And come to think of it, I have been feeling a bit more tired lately.
Interesting. Mihira, are you currently taking any medications, over-the-counter supplements, or any herbal remedies?
No, not really. I take an occasional aspirin for headaches, but that's about it.
Great. Do you drink any alcohol regularly or use any recreational drugs?
No, I don't drink much alcohol at all and definitely no drugs. It's very reasonable, maybe 1.5 ounces occasionally.
Okay, and how would you describe your typical diet?
Well, I wouldn't say I'm a health nut, but I try to cook most meals at home. I do enjoy a burger or fries occasionally, but not all the time.
Alright, that's helpful, Mihira. The blood test will be a good first step. In the meantime, staying hydrated is important. You can also try an over-the-counter medication like Benadryl to help with the itching that sometimes occurs with jaundice.
Itching sounds awful. I'm willing to try it. How to confirm the condition?
Absolutely. We can do a simple blood test to measure the levels. Once we have the results, we can discuss the next steps. The specific treatment will depend on what's causing the condition.
Okay, that makes sense. What are some possible treatment options?
Well, that depends. If the condition is caused by a viral infection like hepatitis, medication might not be necessary. Your body will usually fight off the virus on its own, and the condition will clear up along with it. However, Mihira, if the cause is a blocked bile duct due to gallstones, we might need to remove the gallstones. This can be done with medication, laparoscopic surgery, or even traditional open surgery, depending on the severity.
That sounds serious. Is there anything I can do to prevent that from happening again?
Absolutely, Mihira, making some lifestyle changes can help reduce your risk of gallstones. Maintaining a healthy weight, eating a balanced diet low in processed foods and saturated fats, and increasing your fiber intake can all be beneficial.
A balanced diet and more fiber sounds manageable. How long does recovery from this typically take?
As I said earlier, the recuperation period will depend on the underlying cause. The blood test will give us a clearer picture of the timeline.
Alright, that gives me a better idea. Thank you for explaining everything so thoroughly, Dr. Wright.
You're welcome, Mihira. We'll connect you with a dietitian who can help craft a nutrition plan based on your test results. Let's get that process started today.
Extract 2. Questions 13 to 24. You hear a hematologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How are you feeling today?
Hi, Dr. Evans. Honestly, I'm a little nervous. Ever since I felt that lump in my neck, I can't help but worry.
It's completely understandable to feel anxious, Mihira. Can you tell me a little more about it?
It all started about 2 weeks ago. I was just getting ready for bed, nothing unusual. As I reached up to feel the back of my neck, on the right side near my shoulder, I noticed this bulge. It surprised me because it's new, and I haven't been sick recently, so it's got me concerned. I definitely hadn't noticed it before. It doesn't cause any pain, but it's very noticeable, a firm and rounded shape that certainly caused me worry. I've tried feeling it gently to see if it moves or seems attached to anything, but it feels somewhat fixed in place.
Okay, Mihira. And have you experienced any other symptoms besides this?
Well, I have been feeling more tired than usual lately. Like, even getting through a workday is a struggle. I've noticed some unintentional weight loss, even though I haven't made any effort to lose weight.
Those are important things to mention, Mihira. While these are common symptoms, they can be caused by many things. However, it's important to investigate to be on the safe side. Do you experience any other symptoms?
Yes, I have night sweats. I do wake up sometimes feeling really sweaty, even when the room isn't hot. But I just thought I was sleeping too warmly.
I see. Can you tell me a bit about your family history? Has anyone in your close family had any form of cancer?
Actually, yes. My grandfather on my mother's side had leukemia a few years ago, but he's doing well now.
Noted. Now, let's talk about your medical history. Have you ever had any major illnesses or surgeries?
No major illnesses, but I did have surgery to remove my appendix a few years back. Other than that, I've generally been healthy.
Okay. Do you smoke or drink alcohol?
No, I only drink on social occasions, and I don't smoke.
I see. Let's do a quick examination. Based on the examination and your symptoms, Mihira, it's possible you could have lymphoma. But there are other possibilities as well. To get a clearer picture, I'd recommend some tests.
Oh, that sounds serious. What kind of tests are we talking about?
We'll likely start with a blood test to get a general sense of your health. A lymph node biopsy might also be necessary.
Is that all that is needed to rule out the condition?
Absolutely. But Mihira, depending on the results of the initial tests, we might also look at a PET scan to see if it has spread to other parts of your body.
It all sounds a bit overwhelming, Dr. Evans. What happens if they do find it positive?
Let's not get ahead of ourselves, Mihira. But yes, this condition is treatable, especially when caught early. There are different treatment options available depending on the type and stage if that's what you have. Mihira, for now, the most important thing is to get a diagnosis. We'll schedule those tests as soon as possible, and I'll walk you through each step of the way.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Question 25. You hear a nursing manager called Mihira talking to a team. Now read the question.
Morning, team. Before we begin rounds, I want to quickly go over biometric verification protocols for pre-admission. We've had repeated issues, and I need you all aligned.
Is this still about the facial scans not syncing?
Partly yes, but more concerning is staff bypassing the system when patients report mismatches. That's not an excuse to switch to manual entries.
Even when the patient's fingerprint doesn't match.
Unless the scanner fails entirely, 3 times consecutively, it must be used. Manual entry is only permitted then, and the failure must be logged. Too often, I've seen logs marked unable to scan without incident reports.
So Mihira, the retinal ID's the fallback now?
Only in the ICU and burns unit. Elsewhere, fingerprint remains primary, facial scan secondary. Don't reverse that, even if the face scan seems quicker.
What if the patient's hand is injured?
Then and only then may you go to facial. But always escalate before proceeding. Don't assume autonomy. The real issue is inconsistency. Yesterday, 3 different wards applied 3 different orders.
Got it, Mihira. Stick to fingerprint unless clearly documented otherwise.
Exactly. Consistency protects us and the patient.
Question 26. You hear a community nurse called Mihira talking to a doctor.
Mihira, thanks for coming in. I wanted to discuss Mr. Henderson. His blood pressure readings are still concerning, despite the increased dosage last month. Are we seeing a compliance issue?
Dr. Holloway, it's a complex picture with Mr. Henderson. He assures me he's taking the Ramipril daily, but during my last home visit, I noticed several blister packs from different months scattered on his bedside table, some completely untouched. He mentions sometimes forgetting, especially when his routine changes, like when his daughter visits or he has a bad night's sleep. He also expressed a bit of cynicism about medications in general, believing natural remedies are often more effective, which complicates things. And honestly, his memory isn't what it used to be.
So, more than just forgetfulness, a degree of active resistance perhaps? Or simply cognitive decline contributing?
It's a blend. He says the pills make him feel a bit lightheaded in the mornings, which he dislikes. That sensation, combined with his general skepticism and sometimes just genuinely forgetting, creates a perfect storm for non-adherence. We tried a pill box, but he misplaced it. The side effect, I believe, is a significant barrier for him, beyond the forgetfulness and his views on medication. He's also juggling several other medications for his diabetes and cholesterol, which can be overwhelming.
And the family support.
His daughter tries, but she works full-time. She's worried about him, but can't be there every day to supervise.
Question 27. You hear a surgeon called Mihira conducting a meeting.
Team, let's address Mr. Grayson's post-op complications. He's developed atrial fibrillation with a heart rate of 130, but his blood pressure remains stable at 110/70. However, his oxygen saturation dropped to 88% overnight, likely due to pleural effusion, though his chest X-ray shows no pneumothorax. We've started him on 4-amiodarone and supplemental oxygen. Any concerns?
Could the effusion be masking a pulmonary embolism? His D-dimer was borderline elevated yesterday.
Unlikely. His Wells score is low, and he's on prophylactic heparin. Focus on diuresis for the effusion. The bigger issue is his rising creatinine 1.9 today, up from 1.4. Hold his metformin and monitor for contrast-induced nephropathy post-angiogram.
Understood, Mihira. Should we delay his CT given the renal risk?
No, the angiogram's priority. But hydrate aggressively post-procedure. Oh, and his potassium's 5.6, so withhold his ACE inhibitor.
Question 28. You hear a nurse, Mihira, talking to a colleague.
Hi Alex, quick handover on Mrs. Peterson in bed 3. She's been a bit of a challenge this morning. Her vitals are stable now, but she had another episode of disorientation around 6 o'clock.
Oh, not again. Was it similar to yesterday's confusion?
Very. She was agitated, trying to get out of bed, insisting she needed to feed her cats. We had to gently reorient her several times. The night staff had reported similar episodes, though less intense. The doctor's reviewing her medication chart, particularly the new opioid pain relief she started 2 days ago. We've also noted a significant decrease in her fluid intake since yesterday evening.
So Mihira, possibly drug-induced delirium or dehydration. It's hard to tell sometimes.
Exactly. We're pushing fluids orally, but she's quite resistant. Her family mentioned she often gets confused when she's not at home, even for short trips. This extended hospital stay is likely exacerbating her underlying cognitive frailty. She also has a mild UTI retreating, which isn't helping her mental state. I've placed her closer to the nurse's station for easier observation, and we're using familiar objects from home to try and ground her. The primary focus right now is ensuring her safety and managing her acute confusion, which seems to be multifaceted. We need to reduce potential triggers for her disorientation.
Got it. So, constant vigilance and environmental adjustments.
Precisely. And ensure she completes the course of antibiotics for the UTI. The doctors are still exploring the exact cause of the increased confusion, but we need to address all potential contributing factors.
Question 29. You hear a doctor called Mihira talking to a pharmacist.
David, do you have a moment? I need to discuss the infusion pump situation for Ward C. We're consistently running into issues.
Of course, Dr. Mihira. What's the latest? Is it the calibration problems again, or are we back to the battery life complaints?
Both, unfortunately, but it's more critical now. We had another incident this morning where a patient's medication delivery was significantly off schedule due to a pump displaying an error message mid-infusion. It wasn't entirely clear if it was user error or a device malfunction, but the nursing staff is losing confidence. The older models are proving unreliable, particularly with the newer, more viscous medications we're now administering. The current pumps struggle with precise flow rates for these higher concentration solutions.
Right, so the existing inventory isn't handling the new demands. We've certainly received feedback about the pumps being temperamental.
Exactly. We need to order new pumps, and I'm pushing for a model that offers better precision across a wider range of viscosities. The old ones require too much manual oversight, which diverts nurses from direct patient care and introduces risk. The finance department keeps citing budget constraints, suggesting repairs, but I argue that continued malfunctions and potential adverse events will be more costly in the long run. The immediate need is for devices that can accurately deliver specialized medications without constant recalibration. We also need user-friendly interfaces to reduce setup errors.
I understand, Dr. Mihira. So, the primary driver for this new order isn't just replacement due to age, but a functional upgrade for specific patient needs and safety. I'll get the procurement process moving with that justification.
Perfect. And please emphasize the need for robust error detection systems.
Question 30. You hear a nurse called Mihira talking to a patient.
Good morning, Mr. Davies. Just checking in before your procedure today. We need to confirm you've been adhering to the dietary instructions.
Oh, good morning, Mihira. Yes, I think so. I haven't had anything solid since midnight, just some water. My wife made me a small cup of black coffee first thing, without milk or sugar, of course, because I usually have quite a strong brew to start the day.
Thank you for that, Mr. Davies. The nothing by mouth rule, or NBM, is quite strict. Even that black coffee, unfortunately, could be problematic. The doctor specifically requested no liquids other than plain water after midnight. We've had a few instances where seemingly harmless sips have led to delays.
Really? Just black coffee? I thought it was only food that was the issue. I even skipped my usual early morning medication, the blood pressure pill, because I knew I wasn't supposed to take anything. I'm usually very careful about my health.
I appreciate your diligence with the medication, Mr. Davies, that was correct. However, for this particular procedure, it's crucial that your stomach is completely empty. Even a small amount of liquid, like coffee, can increase the risk of aspiration during anesthesia, which means stomach contents could accidentally enter your lungs. This is a rare but serious complication. That's why we emphasize the clarity around plain water only, and then nothing at all closer to the time. We want to ensure the safest possible environment for your procedure.
I see. So it's about the anesthetic, not just digestion. Mihira, that makes more sense now. I wish they'd explain that bit more clearly on the sheet.
Absolutely. We try to be comprehensive, but sometimes the specifics get lost.
Extract 1. You hear a nurse, Mihira, and an interviewer discussing continuing education.
Welcome, Mihira. Today, we're discussing a critical topic: continuing education for healthcare professionals. From your perspective as a seasoned nurse, what would you highlight as the paramount importance of ongoing professional development in nursing?
Thank you, Collins. It's absolutely fundamental, not just an option. The landscape of patient care is constantly evolving. New evidence-based practices emerge daily. Technologies advance at an astonishing pace, and complex patient needs demand ever-refined skills. For me, the primary importance lies in ensuring patient safety and maintaining optimal outcomes. Without continuous learning, we risk stagnation, delivering care that's no longer current or effective. It's about more than just staying compliant. It's about genuine excellence. It also significantly bolsters a nurse's confidence and job satisfaction, knowing they're equipped with the latest knowledge.
That's a very clear articulation. Given this constant evolution, Mihira, how is this continuous education systematically maintained within a busy clinical environment like yours? It sounds like a significant logistical challenge.
It certainly is, Collins. It requires a multi-pronged approach. Firstly, our hospital mandates a certain number of continuing professional development, CPD, hours annually, linked directly to revalidation. This isn't just about attending lectures. It includes a mix of formal courses, clinical audits, incident reviews, and even peer-to-peer learning sessions. Departments often have dedicated in-service training slots, sometimes weekly, focusing on specific competencies relevant to that ward, for example, advanced wound care or new ventilator protocols. We also have an online learning management system where modules are assigned based on role and identified learning gaps. It's a blend of top-down requirements and self-directed learning.
Fascinating. So Mihira, once nurses complete these educational activities, how exactly is their updated competence then formally assessed or validated?
That's where it gets quite specific. For certain high-risk skills, like advanced life support or medication administration, there are practical skills assessments and simulations, often conducted annually or biannually. For theoretical knowledge, it's typically through online quizzes or written examinations embedded within the modules. Beyond formal tests, there's also an ongoing peer review process where senior nurses or educators observe practice and provide constructive feedback. Competency frameworks are utilized, outlining expected standards for each role, and nurses are often required to maintain a professional portfolio demonstrating how they meet these standards through their CPD activities and reflections. It's a holistic view, not just a pass/fail mark.
It sounds very thorough. Who primarily shoulders the responsibility for conducting these relevant educational sessions or developing the learning content? Mihira, is it internal staff, or do you rely on external providers?
It's a combination, largely dictated by the specialization. For general updates and mandatory training, like fire safety or basic life support, internal educators and senior clinical nurse specialists take the lead. They understand our specific hospital policies and patient demographic. However, for highly specialized areas, perhaps new oncology treatments or advanced cardiac interventions, we often bring in external experts from universities or pharmaceutical companies. Sometimes, the professional nursing bodies themselves develop standardized modules which we then integrate. Our clinical education department acts as the central hub, coordinating these various inputs and ensuring quality.
Thinking about the impact, Mihira, how would you gauge the overall effectiveness of these continuing education efforts on actual patient care outcomes and nursing practice? Is it truly making a tangible difference?
Absolutely, Collins. It's not just a tick-box exercise. We see tangible improvements. For instance, after specific training on sepsis recognition and management, our ward's rapid response activations for suspected sepsis cases significantly increased, leading to earlier interventions and better patient prognosis. We also track incident reports. A reduction in medication errors following targeted pharmacology updates is another clear indicator. From a practical standpoint, nurses feel more empowered and confident when tackling complex cases, which directly translates to safer, more efficient care. It cultivates a culture of continuous improvement, where staff are proactive in seeking out new knowledge.
Thinking about the impact, Mihira, how would you gauge the overall effectiveness of these continuing education efforts on actual patient care outcomes and nursing practice? Is it truly making a tangible difference?
It's incredibly diverse now, which makes it more accessible. While traditional workshops and conferences still play a role, especially for networking and hands-on practice, the rise of digital platforms has revolutionized things. Online modules, webinars, and virtual simulations are hugely popular, offering flexibility around shifts. Many nurses also engage in self-directed reading of peer-reviewed journals, participate in professional forums, or even undertake postgraduate studies. Our hospital supports various modalities, recognizing that different learning styles and schedules require varied approaches. The key is active engagement, regardless of the medium.
Extract 2. You hear a physician talking about managing the outpatient department at the Mihira Research Institute.
Good morning, everyone. Today, I want to talk about a cornerstone of modern healthcare, the outpatient department, or OPD, with a particular focus on how we approach its management here at the Mihira Research Institute, leveraging the principles of Mihira care. The OPD serves as the primary point of contact for the vast majority of patients seeking medical consultation, diagnosis, treatment, and follow-up without requiring an overnight stay. It encompasses a wide array of services, from general physician consultations to specialized clinics like cardiology, endocrinology, and orthopedics, as well as minor procedures, diagnostic imaging, and laboratory services. Essentially, it's the gateway through which patients access much of our medical expertise, providing both acute care for non-emergencies and ongoing management for chronic conditions. Our philosophy at Mihira Care dictates that the OPD should be accessible, efficient, and patient-centered. One of the most difficult aspects of managing an OPD, in my view, is the inherent unpredictability of patient flow coupled with the pressure to deliver timely and comprehensive care. Unlike inpatient settings where patient numbers are more stable, the OPD faces fluctuating demand, often leading to long waiting times, overcrowding, and rushed consultations. Balancing the need for thorough assessment with the sheer volume of patients can be incredibly challenging. This often creates a tension between efficiency metrics and the quality of the patient experience. Furthermore, coordinating care across various specialties and ensuring seamless transitions for patients who might require further investigation or referral is a complex logistical puzzle. We strive to mitigate these challenges through continuous process improvement, a core tenet of Mihira Care. Despite these challenges, the strength of the outpatient department lies precisely in its accessibility and its potential for preventative care and early intervention. The OPD allows for the management of conditions before they escalate to requiring inpatient admission, thus reducing the burden on acute care services and improving long-term health outcomes for the community. It fosters continuous relationships between patients and healthcare providers, which is vital for chronic disease management and health education. It's also a crucial educational ground for junior doctors and allied health professionals, exposing them to a diverse range of conditions and patient interactions. At Mihira Care, we see the OPD not just as a treatment hub, but as a vital community health resource. Managing an effective outpatient department demands a significant allocation of diverse resources. This includes adequate physical space, clearly demarcated consultation rooms, waiting areas, and dedicated reception zones. Technologically, robust electronic health record (EHR) systems are indispensable for efficient scheduling, patient information retrieval, and interdepartmental communication, aligning perfectly with our digital advancements at Mihira Care. Crucially, human resources are paramount, A sufficient number of physicians, nurses, allied health professionals, and administrative staff are needed to manage patient flow, conduct consultations, and provide support services. Without the right balance of these resources, even the best intentions for patient care would falter. To effectively manage an OPD, we employ several key strategies. Firstly, Mihira Care emphasizes a robust appointment system, utilizing online booking and telephone hotlines to streamline patient arrivals and minimize walk-in overload. Secondly, we implement a triage system for walk-in patients to prioritize urgent cases, ensuring critical patients are seen promptly. Thirdly, we focus on continuous staff training, particularly in communication skills and time management, to enhance consultation quality within allocated slots. Fourthly, we embrace telehealth services for routine follow-ups, which significantly reduces the physical presence needed in the clinic, improving convenience for patients and optimizing resource allocation. Lastly, feedback mechanisms, like patient satisfaction surveys, are regularly used to identify bottlenecks and areas for improvement, reflecting our commitment to continuous enhancement. The assessment of an outpatient department's effectiveness is multifaceted, extending beyond mere patient numbers. We primarily assess through key performance indicators, KPIs, that reflect efficiency, patient satisfaction, and quality of care. Metrics include average waiting times, consultation duration, patient turnaround time, and the rate of reattendance for the same condition, which can indicate incomplete initial management. Patient satisfaction surveys provide invaluable qualitative data on their experience, including staff empathy, clarity of communication, and overall comfort. Clinical outcome measures, such as the control of chronic diseases managed primarily in the OPD, e.g., hypertension, diabetes, also serve as indicators of long-term effectiveness. Audits of prescription patterns and adherence to clinical guidelines further ensure the quality and safety of care delivered within the framework of Mihira Care.